glad you're here today. This is your second DTR visit, and I wanted to just kind of go through with you, like, before we did DTR, what were your symptoms? Because I know you were struggling with quite a bit.
Yes, I was having a lot of neck pain, a lot of jaw pain, tension around my jaw, around my neck, on my back, specifically one part of my back. And
Lower back or upper back?
upper back.
Okay.
Upper back. And I've seen physical therapists, massage therapists, just about anyone to kind of help me with the pain that I've been having.
Sure.
And just no luck.
Okay.
No luck there.
How long has this been going on?
I want to say 30, probably 10, 11 years now.
Okay.
Yeah.
Is it something that's been progressively getting worse as you get older, or?
It was getting worse, for sure. And it was to the point where I couldn't open my mouth.
Okay. Would you say that you were locked shut, or would you say you just had a restricted range of motion?
I would say restricted range of motion.
It hurt to open wide, but you could push through it if you had to?
Yes.
Not that it would stop and you couldn't go any farther?
Correct.
Okay. All right. That's good to know. Okay. So you had DTR therapy 2 weeks ago, and the range of motion has been pretty incredible, that progression from what we thought was muscle splinting, and it was, because if it was a joint-based issue, the range of motion wouldn't change. But you didn't have any deviation, you didn't have any deflection, you opened straight up and down, and ended up releasing your lateral pterygoid. How was that?
It was painful at first, and then things started to calm down, but then over the weekend it just flared up again. And then that's when things started getting worse and I couldn't open. Okay.
Then we did two things on you. We did a tongue tie release, right? And what were the effects of that?
That I've noticed one of the biggest problems that I had was that I felt a lot of tension in my mouth, specifically my lower teeth, a lot of tension. And I thought that it was my lingual bar that I had from braces. But after that was released, it just relaxed. And I don't feel it anymore.
Lower anterior teeth? All the way across?
All the way across.
That's fair. Okay, so we did that about a month ago.
I think so.
Yeah, about a month ago. And then 2 weeks ago, we did visit one of DTR therapy. And we hooked you up and we checked out your bite today as well, because this is your second visit, your first post-op. And walk me through what you've experienced since we did the DTR, because that was just last week.
Yeah. It was pretty dramatic, the change that I saw. Immediately noticed not a lot of jaw pain and my teeth being able to touch for the first time and finding a balance, which I always thought for many years that the way I bite is the way you're supposed to bite up until the adjustment. So I noticed that difference. And then more recently, I started noticing less, like no neck pain, and my back pain has not been present. And normally it's something that I notice immediately. And I think I was waiting to see maybe if it was DTR that made the change or something else, but nothing explains it other than the adjustment from
That's
DTR.
The only thing that's happened, right?
Yeah.
Okay. So the upper pain that was there is now gone. That's fair. What about like chewing and eating? Because you told me a story about trying to eat a banana.
Yes.
The morning that we did DTR, and you were unable to eat that.
Yes.
Okay. So kind of walk me through the mastication changes.
I'm able to open wider. I don't feel that tension immediately when I'm biting down or opening. I still have a little bit of soreness, but it's so minimal that I can eat anything. Right after DTR, I went to go have sushi. And when you have sushi, you tend to have to open wide.
Sure.
And I noticed that I was doing just fine.
That's pretty fast.
Yeah.
So facial pain, neck pain, back pain, were there any headaches or migraines involved in what you were experiencing?
Would get migraines here and there, and I haven't had one. A little bit of headaches, but not since DTR.
Okay.
I haven't noticed anything, and I've noticed that my sleep has improved. And
Sleep has improved.
yeah.
Tell me about that. Does that mean you feel like you're more rested? The sleep's not fragmented? You're sleeping through the night? What do you mean?
I'm sleeping through the night.
Okay.
My body feels more relaxed. I tend to wake up in the middle of the night having to adjust my neck because I don't use a pillow. I use towels for my neck from constantly having tension on my neck. And now I don't find myself waking up in the middle of the night to adjust. I just am able to put my head down and relax and be just fine the next morning.
You sleep through the whole night?
Yeah. Yeah. It's to the point where like I'm going to bed a little earlier and I'm able to sleep through the night, do just fine. My husband is like, you can't even stay up to watch a movie anymore because you're immediately crashing. I'm like, I feel relaxed.
That's a big thing. One of the things that a lot of patients would report to me is that a lot of times, because they're in so much pain, it takes them several minutes or an hour of tossing and turning before they get comfortable enough to go to sleep. Do you notice that same phenomenon? Or are you able to lay down and just, you're out?
I'm able to lay down and just go out because it was before where I was like constantly adjusting the towel, trying to find the sweet spot, and then going to sleep and then waking up like 2 hours later having to readjust and then having a hard time going back to sleep because the tension is just so strong. I was given, I'm prescribed cyclobenzapine for my muscle relax, and I also was taking meloxicam for the neck pain. Haven't had to touch those.
What does that mean to you?
It means that DTR is working and that it's improving.
Feels good to feel good, doesn't it?
It does.
I love doing this as my major therapy because it crosses so many borders, and you can make a really nice orthotic, but a lot of people that I found just don't like to eat with those things. And so even if you have a perfectly designed orthotic and you take it out to eat, you're eating with the same crappy bite that you had.
Right.
And so being able to, my goodness, you're having a hell of a response, and be able to check all these boxes, and sleep is improved and chewing is improved and neck and shoulder and back issues are starting to resolve. This is a known thing with the bite being off. So I'm not shocked at all. I'm shocked at how fast you're healing. Well, that's a blessing. That's great. Probably because you're 30, right? And not 80 doing this.
Yeah.
But even then, we had an 80-year-old today that had 90% healing in less than 24 hours.
Right.
So age isn't always a correlation. It's how well does this person heal versus somebody else. So do you have any questions for me about anything?
I mean, I was wearing a night guard for many years, but the night guard always had to get adjusted because my bite always fell off after a while. So I guess question is, with this improvement, do I need to be wearing a night guard? Because I don't notice if I'm clutching at night, but I don't have the same symptoms that I have when I was clenching and grinding.
Yeah. So a night guard per se isn't really a therapy. It's just a barrier to protect teeth. And now that the bite has bin dialed in and you don't have the same symptoms and those are going away, yeah, I would say the therapy is built into the teeth. So as your teeth come together, you don't have those same problems. Don't wear the night guard. We didn't measure a night guard, but I bet if you were to bring it in and measure it, it wouldn't be as precise as what you have now, because you're balanced now. Now, does that mean you won't ever have to adjust the bite in the future? No, it doesn't mean that. But when you get it to a certain point, it's pretty much a self-maintaining system, like the body usually is, right? But if you're too far out of bounds, we need help.
Yeah.
And that's the same with, diabetes, oral facial pain, TMD, the bite, blood pressure. We do things, a lot of that's medication, some of it's skeletal muscular. And when you can control that or improve that, you get the results that you're experiencing. So that's great. It's a blessing. Wonderful. Yeah. I'm happy for you.
Yeah, I'm glad my face doesn't hurt anymore.
You glad you did it?
Huh?
You glad you did it?
Yeah. Yeah, I'm really happy. I've been watching patients come through and been so jealous of the treatment that they've been getting, and I'm just glad I finally went ahead and did it.
Well, you didn't ask me about it until just a couple of weeks ago. But most of the people in this office experience this for different reasons.
Yeah.
They have different symptoms, and they have different reasons why they want to have it done. But there's only 2 people that have not experienced this.
Yeah.
And the great thing about, treating somebody like you is not only are you a sufferer, but you're also a co-provider in helping all these people. And so when I step out of the room, they turn around and ask you questions, and you're like, they don't sound crazy, right?
Yeah.
And that's welcoming to them, because a lot of them have been told, you're crazy. There's no reason why that would hurt like that. And then all of a sudden, somebody has an answer. Oh, it's a great improvement.
Yeah.
All right. Well, we're going to keep following you. I'm going to close out this video, but I'm not done treating you. You have a couple of more visits where I'm going to be monitoring, and we didn't make any changes today because I think you're pretty much balanced, and we'll just continue to monitor you. Okay.
Okay.
Thank you for letting me be a part of your journey.
Thank you.